Greetings. Welcome back to the Medical Weight Loss Show. I'm your host, Dr. Andrea Walker, family nurse practitioner, weight loss specialist, IFBB Pro, and owner of Serenity Health Innovations and Wellness, located in Central Florida. Today, I want to talk about something a little bit different. I talk often about GLP-1 medications because they work. They improve metabolic health, reduce disease risk, and help many patients regain control over food. But today, we're talking about something that doesn't get enough attention because not all weight loss is healthy. And sometimes when we don't set clear boundaries, weight loss can move from therapeutic to harmful. Today's episode focuses on body dysmorphia viewed from two important perspectives. When weight loss goes too far and BMI drops into an unhealthy range, and when patients are losing weight appropriately but cannot see their own progress. We'll also discuss BMI categories, celebrity influence, and why GLP-1 misuse will become a long-term problem if we don't address it now. So let's start with what exactly is body dysmorphia? Body dysmorphia is a distorted perception of one's body. It occurs when what a person sees does not match reality. This condition does not only affect underweight individuals, it affects people across the entire weight spectrum. In medical weight loss, body dysmorphia often appears during rapid physical change. The body changes faster than the brain can adjust. The scale shifts, clothes fit differently, labs improve, but the mirror does not reflect that progress. When that disconnect happens, patients may either continue pushing weight loss beyond healthy limits or feel dissatisfied despite being metabolically healthy. But what does this mean? So let's talk BMI. BMI is not a diagnosis, but it's a valuable screening tool. So here are the standard categories. Underweight BMI is anything less than 18.5. A normal weight is considered 18.5 to 24.9, which is where I like my patients to be if they want to be there. Some desire to be in the overweight category, which is a BMI of 25 to 29.9, and I'm okay with that as well. Once we get above 29.9, we move into what is considered obesity. So there's several different classes of obesity. Obesity class 1 is 30 to 34.9. Obesity class 2 is 35 to 39.9. And obesity class 3 is 40 and above. It's also known as morbid obesity. Keep this in mind. BMI must always be interpreted alongside body composition, muscle mass, lab work, hormonal health, energy levels, menstrual function for women, bone health, and mental health. However, BMI does provide clinical boundaries, and ignoring those boundaries puts patients at risk. So, what happens when BMI drops below 18.5? We've all seen many of the celebrities, and you look at them and you're like, what is going on? So, let's be clear here. When a patient's BMI or a person's BMI drops below 18.5 and GLP-1 therapy continues, we are no longer practicing medical weight loss. We are now engaging in medication misuse. At this point, the body is not losing excess fat because there's no fat to lose or very minimal. It is now losing lean muscle mass, hormonal stability, bone density, nutritional reserves, and clinically, this presents as fatigue and dizziness, hair thinning or loss, amenorrhea in women when they no longer have their cycles, Individuals will develop cold intolerance, GI dysfunction, anxiety around eating, and a fear of stopping the medication. And that fear is significant. If a patient is afraid to stop a medication despite being underweight, that is not success. It is a warning sign. And keep in mind what I said, if they are underweight. As a provider, I want to say this clearly. Continuing GLP-1 therapy in an underweight patient is not ethical care. These medications are tools, not lifestyle accessories. Some people, they will require stopping points, reassessment, and transition plans. There should not be anyone who is considered underweight by the BMI standard on a GLP-1. So now let's talk about losing weight, but you can't see it, a form of body dysmorphia. Many patients lose substantial weight and reach a healthy BMI, yet feel dissatisfied. They may say, I don't see a difference, but this is common, especially in patients with a long history of obesity. It's like everyone else sees it, but the person themselves cannot. The brain often retains an outdated body image. This is then worsened by social media comparison, celebrity influence, and unrealistic body ideals. In these cases, the focus must shift away from appearance and toward measurements, strength, lab improvements, function, energy, and overall health. Health is not defined by endless weight loss. Now, let's talk about celebrities. Public figures have played a major role in normalizing extreme thinness, and this is not acceptable. Many celebrities use GLP-1 medications without transparency or medical context. What we don't see discussed are hormonal suppression, muscle loss, nutritional deficiencies, mental health impact, and of course, long term metabolic consequences. This creates unrealistic expectations for individuals and pressures them to continue weight loss beyond healthy limits. What is promoted online is not evidence based medicine. GLP-1 medications can be life changing, but only when used responsibly. Weight loss should improve health, not compromise it. There is a point when continuing becomes harmful. The goal is not to be the smallest version of yourself. The goal is to be the healthiest version. This is why I don't mind if some of my patients have a BMI between 25 and 29.9. Even though they may still be considered overweight, that is perfectly fine. Sometimes the most responsible decision in medical weight loss is knowing when to stop. So please keep that in mind. I hope you enjoyed the show today. Thank you for listening to the Medical Weight Loss Show. And if you did enjoy it, please like and share. And don't forget, keep working out, keep eating healthy, and drink your water. Until next time, bye for now. Have a great week.